I'm joined by Dr. Claudine Ogilvie, who's based in South Wales, and she's a paediatrician. So nice to meet you, Dr. Ogilvie.
Hi. Nobody calls me Dr. Ogilvie, it's just Claudine.
Nobody calls you Dr. Ogilvie? Was I being really formal? But you deserve the title. Why not?
Because most of the time in hospital, I think it's changed over the last few years, that's my understanding, since I moved to the UK. And so even the most senior nurses, senior doctors, people are usually called by their first name. And I think it's to make us seem less intimidating.
Yeah.
And children, it's been my experience, the children quite enjoy that. They're not going to remember Dr. whatever. But if I say, hi, my name's Claudine, then I seem like I'm really approachable. So, yeah.
That's cute. That's super cute. I like that. It kind of feels like less of a hierarchy, kind of.
Yeah.
Yeah. Okay, great. Okay, Claudine. So we'll, we've kind of like chatted quite a bit before this, but I think we're going to dig a little bit more into some of the things you discussed on the previous video. So I guess one of the first questions I want to ask you is, what intrigued you about medicine? Thinking about, from quite a young age, we've got, I guess people should know that 4% of doctors in the UK are black, and the majority of that will probably be West African doctors. There's quite a low percentage in the representing the Caribbean in the UK. So, what was it about medicine that kind of intrigued you as a young person? And was there any things in your youth, particularly when you were young, that almost, I don't know, started a fire within you to kind of be curious about biology, the body, medicine?
I was always a really inquisitive child, much to the chagrin of my mother. I was like, Mommy, why? But why is this? And why is that? And I needed to know how everything worked, why everything worked the way it worked. And in particular, the things that intrigued me were often to do with the body. But apart from the fact that I was curious, I was also greedy. And according to my mother, I went to my first pediatrician's appointment, private doctor. My mother didn't like to wait in line. And she had lollipops on her desk, and I got a lollipop. And I left the office and I said, Mommy, when I grow up, I'm going to be a doctor just like Dr. Nelson because of the lollipop, because, bribery. I wasn't over bribery. Bribery was fantastic. And I think that was the moment I decided it. I also at the time wanted to be a ballerina, but I'm a little bit clumsy. I can't really dance so well. I wanted to be a singer, but I can't sing.
Right.
I wanted to be an artist, but I learned very quickly that I'm not as creative as I think I am in my head. So when I started to eliminate all of these things, the only thing that I really knew that I could definitely do was the medicine thing. Right. So I kind of stuck with that one.
Right. Oh, great.
And funny enough, you say that 4% of doctors in the UK are black, whereas I think I don't think I know. Growing up, I didn't know any white doctors. Right. As a child, my doctors were Dr. Otway, Dr. Nelson, Dr. Simon, Dr. Thompson. All of them were black women and black men. And in my own secondary school class, there's a PhD in pharmacology, so she's a doctor. There's an internist, so she's a doctor. There's me. There's a couple of other doctors. It didn't seem at all strange, foreign, out of my reach. It was very much expected. It was expected of me that I was going to do this thing. And I think part of the problem in the UK is that oftentimes, I can't remember who said it, but you can't be what you can't see.
Yeah, absolutely.
And how can you know that it's possible if your doctor doesn't give you lollipops and she doesn't look like you, so.
And that's why I guess we have this huge narrative around representation, which you've obviously seen being here. There's quite a lot of backlash about a lack of representation for us, particularly in the media, on the TV, in positions of power, in positions of leadership. We just have little to no representation. And of course, you know, this is a white country, it's a majority white country, so you would expect that there would be a larger percentage. But, you know, to have sort of like 4%, you know, black doctors in the UK, that's extremely low. And I guess coming from the Caribbean, where everyone around you looks like you, it's to be expected. So did you find that children in your class and the children that are around you, did they have the same kind of expectation that, you know, it's quite normal for a lot of the kids to want to get into the medicines or sciences? Was it quite
In
normal?
my primary school,
dentist or...
in my primary school, I think about half of the girls, there was 26 of us, I think, in primary school, or 23 of us. I think about half of the girls wanted to be doctors.
Oh, wow. That's great.
One girl I remember wanted to be an economist, and she is. It's my cousin.
Wow.
Another cousin of mine also wanted to be a doctor. She started pre-med, hated it, and now she's a mechanical engineer. But even from my primary school, there were 24 of us, 26 of us, however many it was. And maybe 3 didn't go to university.
Wow.
Maybe 4.
That's crazy. So,
you know, it's just expected. You go to primary school, you go to secondary school, you finish secondary school, you go to A-levels, and you finish A-levels, and you look for a job, and then you look for a way to get into university.
Okay, so do you think this might be a bit of a stretch, a bit of a Pan-African question, but we know why. We know why. This is historically a racist country. We know that our lands were colonized. We know that we're in the Caribbean because we were taken there. We know that when we came here, our parents, our grandparents came here during Windrush. Even though we were invited, they were treated very much like less than human. And that still exists today. Do you think it's possible for us to be here and get to a point where our kids will, you know, start to aspire to be something more because representation will increase? Or do you think actually, you know, it's probably best that we go back home, we kind of go back home, go back to where we came from, try to build up the lands where we came from, try to invest in our own countries? Because what happens with, I'm not saying to do this, I'm not saying to not do this, but, you know, if you look at kind of like the Chinese who may go to the UK or they may go to America, they'll study and then they'll go back home. Where with us, usually when we leave, we don't go back home. We leave and we stay in the places that we go to, which doesn't really help our continents and the places where we came from. Do you think there will ever be a time where, you know, this is going on sort of 4 centuries now, you know, where we've been systemically been oppressed and denied things, and there is a bit of a hype now because of what's going on in the climate, you know, which normally happens when there's a riot or someone's murdered. Everybody kind of gets up in arms and, you know, people react, and then it kind of slowly, subtly returns back to that oppressive system that we're so used to. Do you think there's going to be a time where little black children will kind of see black doctors like yourself and it will become the norm, if you like? Or do you think that's kind of like, nah, you know, that's a bit of a reach? It might be good to kind of integrate back into the Caribbean or into West Africa or to wherever you've come from, Latin countries or whatnot.
So I had this discussion with a friend of mine regarding, because this year I've applied for my indefinite leave to remain in the UK, and he's had his for a while. And he said, you know, he's not willing to give up his, because he can't have dual citizenship where he's from. And he said he's not willing to give up his passport. And I said, well, I can have dual citizenship as a member of the Commonwealth, but I will get a British passport because, one, I live in this country and I deserve to get all the benefits of the work that I do for this country.
Absolutely.
And on top of that, my ancestors, my great-grandfather, my great-great-grandfather, my great-great-great-grandfather, and how many generations beyond, the ones that were in the Caribbean and the ones that left West Africa by force, have also contributed to the riches and the wealth of this country.
Absolutely.
Therefore, I am wholly entitled to whatever the benefits of being a citizen of this country has or are. Not to mention the fact that until 2015, it was, that the Treasury was still paying back the debt. So my money has actively contributed to paying for people, to compensate people that used to own my own family. So on the topic of, do I think we should go back? I think we can go back if we want to, but do I think that we have a right to stay here and demand for a space to be made and make a space for ourselves? Absolutely. And I think it is what we owe the people who were here in the 1600s, the people who were brought here from Jamaica, who were brought here from Barbados, who were brought here to the UK, to Scotland, to Wales, to England, taken from Africa, brought to the Caribbean, taken from the Caribbean, brought here as servants, as slaves, as whatever. And if those people, their only hope was believing that we, whatever they did, the atrocities that they suffered, were in the hope that one day we would be able to have the things that we currently have and have the things that we are striving to have, and to give up would mean that we were failing them. And so I don't think that that is necessarily the answer. On top of that, we have also seen what happens when countries use oftentimes less than ideal methods of doing away with the powers of the developed countries. And in cases like what happened in Zimbabwe, what is kind of transpiring in South Africa, what happened with Idi Amin in Uganda, I believe, if I'm not mistaken. We've seen how those things happen and how those things corrupt those leaders, even if they started with good intentions. But also we've seen Fidel Castro in our more recent history as well. We've seen how the developed world then deals with those things, how they continue to ostracize those countries. Meanwhile, we've seen what happens when Germany did something equally or even more atrocious, but how they've somehow been forgiven.
Yeah, absolutely.
So to think I think it's quite myopic to think that we can go home and we can just say good riddance to these people who have essentially taken all of our wealth and left us with very little other than human resources, and say that we'll now be able to build our own Wakanda. We can't.
Yeah.
We can't do that. And we have to learn to live in the society that we are now in, that have now been created. And if you look at the stories of when people came over in the 50s, or even when they came over in the World War, here in Cardiff and in Barry, so in South Wales, there were Black people that were killed. There were race riots here at the turn of the century, things that aren't talked about. But I know that every Black British person of Caribbean heritage here has a story of a grandmother or a great aunt or somebody who came here with their qualifications from back home as a teacher, as a nurse, as a who, as a what, and were not allowed to do anything but sweep the floor or work in somebody's house, despite having those qualifications. That qualifications that were good enough to treat white British people living in the colony, but not good enough to treat white British people living in the UK.
Right.
And we have come far enough that I walk into my hospital every day, and if somebody was to, which has happened, somebody was to say, I don't want to be treated by that doctor because she looks the way she looks, then that person gets chastised. I am not then made to feel that I cannot have the job that I have. So we have come a long way, and we have to acknowledge the fact that we have come this far. Is there work to be done? Absolutely. Is there still so much racism happening? Is there still too many stories of oppression, too many stories of microaggressions, too many stories of macroaggressions? Yes, those things are still true. Those things are still happening. But we can't neglect the fact that we have made progress. We've made so much progress, and we still have to take time to celebrate how much we've done in that space of time, and how much we're doing even right now. Look at this.
Yeah,
this wouldn't have happened in the 50s.
Yeah, absolutely. And I think, it's kind of, Cuba is a good example. And then even when you look at places like Liberia, it's meant to be like our free land, our paradise, and that absolutely is an essence of, we will punish you for your freedom. And Haiti is probably the biggest example of that. If you have some autonomy, or if you're self-sustaining, then you will pay for it. So it's like, I guess there's a bigger picture, and there's a lot more to think about than this kind of utopic idea that's in people's heads. So it looks like we're here to stay for a bit, which makes me a little bit sad, because I would like to be, when I visited Jamaica in 2018, and I hadn't been since I was 8. That's my bird, by the way. I've got a little bird, so if you're tweeting, that's him. So I haven't been since I was 8, and when I got off the plane, people laughed. I started crying, because growing up in the UK as a child, every child's innocent. I don't believe in innate kind of personalities necessarily. I don't really believe in that. I believe that every child is innocent, and when you're sort of 4 or 5 years old, you expect that every adult, or every kind of environment that you'd go into, you'd be treated like the other children. And there was more than not times that I would go into a white environment that I was visibly treated different because I was a black child, and I'd be the only black child on the beach, at the seaside. I'd be the only black child on trips. I'd be the only black child in certain events. And I always felt terrible for it, because I was called, I've been called nigger as a child from other white children. So to just be around your peoples, to just go back home and be around your peoples and experience that, and not feel like you don't even think about being black, like being somewhere where I don't have to think about I'm the black one, or that feeling, you can't buy it. You can't buy it. I don't know what it is, but it's a part of your identity. It feels like home. You find you inner child, that little child, even if you go in at 30, 40, that small child that was, had to go through that trauma, feels a little bit of acceptance in that moment, So, but there's absolutely a bigger picture, and there's a lot more to it. It's not as easy as Marcus Garvey's dream, that he was talking about in the 30s. He was talking about this, nearly 100 years ago. So that nicely brings me on to medical racism. And one of the areas that we are kind of really looking into and do some research around is those barriers that are in place, that have been put in place to stop Black people having access to adequate treatment, to equal treatment, hospital healthcare within our communities is always poor, under-resourced, overcapacity, and that happens in white areas that are deprived as well. But I think just before we was talking about Black women being 5 times more likely to die during childbirth. And these statistics are not just national, you know, this kind of goes out to the United States as well. It's kind of a global thing where we are the minority. So what kind of things have you experienced being a Black doctor? You kind of touched on it a little bit there when you were talking about, but what kind of, I guess, what kind of things have you experienced and seen as a Black doctor, and what do we need to do as a community to start working towards, I don't know, a heavily vetted process or system where we're not losing out, where we're not dying because, I don't know, I've been given the wrong advice or we've been turned away. We did some research into Black people not being believed when they are expressing pain. So there were some studies done, and it showed that white doctors were less likely to believe a Black person when they're saying that they experience pain. And looking into the background work, I don't know if you're familiar with Dr. Joyce DeGruy. And Dr. Joyce DeGruy talks about post-traumatic slave syndrome, and she does a lecture on experimentation on Black people, and there is so much it will make you just, it is shocking. So yeah, what kind of things have you seen? What's your outlook on it? And what kind of things can we do as a community to just vet a bit more and protect those who are vulnerable?
The issue of differential treatment of Black people with medicine it's a multi-pronged issue. It starts with the fact that there's a very long history of distrust between the Black community and the healthcare system, stemming from a time when they were using spoons as the first speculums to operate on enslaved women who, because they were being forced to have children year on year, ended up with complications of pregnancies, things like prolapse, and other problems, and urinary incontinence and other things. And a now very famous father of gynecology would use the kitchen spoons to experiment, and couldn't use white women because they would be in pain, but Black women did not experience pain. Although some of them did scream, it was difficult to understand why they were having that reaction, because they didn't experience pain, because Black women don't experience pain in the same way as, I believe they were referred to as, it wasn't dainty the term was used, it was proper, I can't remember, but a term meaning more evolved women, meaning white women.
Right.
And like you touched on, there have been numerous incidents in Zimbabwe, in Nigeria, in Jamaica, in Grenada, of periods during enslavement and post-enslavement, where there was unwitting experimentation on Black people, because the people that were involved in these clinical trials were unaware. They thought that they were receiving free healthcare, and these were poor people. So on the back of that, Black communities in the West, especially, have a certain amount of distrust of healthcare providers and the healthcare system, which is not completely unwarranted. And I say that as a healthcare professional myself, because we have to understand where it is coming from. So we are reluctant to seek help in the first instance. We are more reluctant to seek help from our community in the first instance, and our community will tell us to drink some kind of tea, or to do this, or to rub with this, or to go and bathe in this water here, so this kind of something. And in some cases, because we weren't being given, even if the medicine that we were being given by our by our community leaders and our community healers was not effective, it was also not harmful.
Mm.
And the medicine that we were being given by healthcare providers was, in some cases, in too many cases back then, harmful.
Mm-hmm.
So we learned to trust our community healers over these healthcare people. Now, there have been a lot more checks and balances in recent history, and I'm proud of that. I'm a proud member of the healthcare community, and I'm proud of the level of accountability that we now have, especially in the developed world. But there are still problems. Up until 2012, there was, in a nursing textbook acknowledged and recognized by the NMC, it said that Black people believed that suffering was inevitable, and therefore, you know, we could be left a bit longer with our pain because it helped our personal, something like that.
Book up until 2012, did you say?
2012, yeah. There's a BBC article about it, and it's difficult to read. And if you think about 2012 was 8 years ago. Yeah. How many nurses are in practice right now? How many midwives are in practice right now that would have read those books?
Yeah, absolutely.
And their nursing degree was 3 years, 4 years. They've internalized these things. They don't have much contact. There's some communities where they haven't seen a Black person.
Yeah.
The first time I remember that one of the nurses, I have been in the UK for 6 years. 2014 is when I came here. And one of the nurses said that I was the first Black person that she was having a conversation with in 2014.
Wow. That's in Cardiff?
And that's in Bridgend. I live in Cardiff, but I work in Bridgend.
Right.
So, like, if all you have to go on is these things, then we will be treated in that way. And if we are underrepresented in the healthcare community in terms of healthcare providers, then who is going to change that narrative? Right. So it is difficult. That I understand how difficult it can be dealing with somebody that's different from yourself. Mm-hmm. And not understanding maybe things like cultural nuances and finding them strange and all of those things. But it all translates to us being at a disadvantage. And how to fix it, I don't know.
Well, what can we do what can the Black community do? Not necessarily to fix it, but to improve on, because one of the things we're trying to do is when someone vulnerable, elderly goes into the hospital, we want to have Black health advisors almost acting as a phone chaperone. So if they go to the hospital, there's something that they don't understand, they can phone the phone line, like you'd have your mum, you know, like if your mum goes in the hospital and she'll phone you and say, oh, may I have this? And you'll explain, mummy, it means this is what you need to do, A, B, C. So that's one of the things that we're implementing as a way to kind of vet and improve.
I think that would be incredibly important. It is a matter of, part of it is British society. It's very strange to me to, people here are very, there's a culture of not wanting to ruffle feathers, of not wanting to make a fuss. And that's been internalized even more by the Windrush generation. We have learned to small up ourselves.
Yeah.
We have internalized this idea of making ourselves as inconspicuous as possible in spaces, not occupying too much space for fear of being noticed, for fear of being chastised, for fear of whatever it is. And this is for fear of being chastised by our parents, because that is how they learn, because children must be seen and not heard. And that comes down from, if the slave master had to discipline an enslaved person, whatever discipline was going to be dealt was probably going to be harsher. So they would try to make sure that you were always kept in line. Your own people try to keep you in line so as to keep you safe or to keep themselves safe.
Yeah.
Now we don't need to do that anymore. But we still have that internalized thing.
That goes back to what Dr. Joyce DeGroy talks about, this post-traumatic slave syndrome, these things that we do and act out, and we don't know where it comes from. And it comes from that, she talks about how a lot of Black mothers belittle, almost denigrate and put down their child's talents or whatever they're doing. And she said, people will often say, oh, Black mothers always put down their kids. And she talks about how the slave master may come along and see that, a child is really good at what they're doing, really good. And he'll say, he's a strong boy and he's doing really well. And the mother would go, no, he's not strong. He's not good at he's not good at all. Like he's stupid. He's stupid. He doesn't have any talent. And she said that's kind of been passed down because that was a way to protect. That was the only way to put the child would be sold. Yeah, the child would be sold after. That was the only way to protect the child from that slave master. So it became just this internal thing that mothers passed down to mothers, and not realizing we don't need to do that anymore though. Like no one's going to take away your child now, but we have no understanding of this. There's no education around it, not unless you consciously seek it and you go out to kind of look into why this happened. But I think we're growing and there's a lot more information out there around some of these issues that we have in the community.
And I think, so that's the first thing I would say. Mm-hmm. If you don't feel comfortable, doing it for yourself, every Black family have one loudmouth person. Take the loudmouth person with you. Make the loudmouth person ask questions.
Yeah.
Because you need that. You need somebody who's going to advocate for you.
Yeah, absolutely.
Especially if it's a person that may not understand. Like, look it up, Google it, ask, demand that you get something to read. Yeah. I try as much as I can to give parents printouts. I also try, my patients range from brand newborn to 16 and sometimes 17, 18 years old, but mostly up to 16 years old. And I pride myself on the ability to explain healthcare, sometimes complicated healthcare problems to my patient. Obviously not to the newborn, but to the very young child, to the toddler. At 2, I could tell you that I'm going to look inside of your chest it's going to be a fancy picture. It's going to show me that your bones and everything inside of your chest. At 12, I can tell you I'm going to do a chest x-ray.
Yeah.
But it is my job as a healthcare provider to explain to you as the patient and then to your parents as well. And oftentimes, too often, healthcare providers don't realize that. They don't have the time or the desire to do that.
Or the desire, absolutely.
And it is our job as the patient, and sometimes we're throwing a lot of information at you because we have to tell you what's going on. And it might take a little while for you to process it. It's okay. You can request an appointment to explain what you've been told. You can request printouts, go home, write down all the questions in a book, bring it back and say, these are all of my questions here. But it is important to understand what is going on with you. It is important to understand every medicine that we are giving you and what the medicine is for.
Yeah. And what tests? I always we'll send you for a test. What's the test for? What's going to happen? Like understanding the processes, and it's these small trivial things that we think are not important, but they are. And often I go to the doctor, I feel rushed. I feel like the doctor's rushing me out of the room and on to the next. And it is because of, time. They've got 16,000 patients at the surgery. And it's just like, so imagine our, parents who have colloquial language, who have a dialect, who, might say, someone gave me an example and it made me really laugh because it's so true. And it's like, now they're having appointments over the phone. Like my dad would say, oh, my foot hurt. and he's talking about his knee. You know, he's talking about his knee.
Oh,
Talking about his, you know, so, and I thought, you know what, that is so true. But it's those little things there that they won't take the time out to kind of, they're not tactful or patient enough to say, okay, let me make sure that that person can repeat back what I've just explained to them, you know. So yeah, I think
I personally could never be a GP. I take forever with my patients. Like, I will speak to my patient and I'd say, okay, now I want you to tell your mom or tell your dad what I said that you've got. Because I need to know that they're understanding me. I don't deal with a 3-year-old or a 4-year-old, but I'll deal with an 8-year-old. Because it's important that they understand those things, you know?
Absolutely.
And I think that is the biggest thing that I would say in our community. It is allow our children to ask questions, because sometimes they have questions to ask of the healthcare provider. Allow our children to complain to the healthcare provider. If I'm hurting you, it's okay to tell me you're hurting me, don't touch me.
Yeah, absolutely. And you know, there is this essence of, like you said before, like seen and not heard. And no, we don't need to do that anymore.
No.
The voice.
So I'd say all of those things are very important. And if you are in pain, if you believe that something isn't wrong, is wrong, ask for a second opinion, a third opinion, a fifth opinion, because doctors can get it wrong.
Yeah.
They can. Not just that, it is also that you may also not have an organic condition, meaning that you may not have like a physical thing wrong, but we may discover that this is an underlying mental health problem that's causing you physical pain. This is an underlying condition that does not have any physical manifestations, but can also cause you pain, can also cause you discomfort, can also cause you whatever it is. Like, it is okay to ask questions. Say, can you consult a colleague? Is it okay if I'm seen in the hospital because I really feel like there's something else going on? All of these things are okay. It's okay to advocate for yourself. It's okay to demand.
Absolutely.
Because, and sorry, one last thing.
Go for it.
If you feel like you have been treated unfairly, put in a complaint. Do not just cuss and walk away. Write it down and put in a written complaint, because that, then and only then will something be done. If you just cuss and leave, nothing will happen. Write it down, ask to have their complaints processed, tell them you want to hear back, you want feedback about what has been done about your formal complaint. Please complain.
Absolutely. And they could also contact PALS as well for advice, further advice. And a lot of people don't know that. You know, our parents would never challenge authority. My parents would never challenge a doctor, ever. So yeah, a lot of people don't know that, so thanks for that. And this brings me on to my last question, which is about, so you've done a video about, which included some information around vitamin D. So I guess I kind of want to do a little bit of myth busting and just get the facts here. Our immune system is really important. It's important to everybody. But there are some kind of pseudo scientific plots of information out there. You know, drink busy, drink ginger, drink celery. That's going to boost your immune. You'll get a super immune system that will fight off cancer. You know, how accurate is that? What should we be looking out for? How do we support our immune system to function to its capacity? What kind of things do we need to do to do some things are just out of our control, and sometimes your immune just doesn't function. But what can we do? And what's the facts? Tell us a little bit about the facts around immune and our culture.
Unfortunately, I am neither a tabloid journalist nor a politician.
Yeah, okay.
Nor somebody looking.
Did you say unfortunately?
Unfortunately.
Yeah, okay. You sound like one. Might be a newbie though. No.
And because I'm not any of those things, I can't speak with the absolute certainty that I often hear politicians speak with. about things that we are not absolutely certain about,
Mm-hmm.
like coronavirus, for example.
Right.
Therefore, I can say with absolute certainty that there are many things that we don't know in medicine.
Right.
What we do know so far is that what you aim to get is an immune system that is functioning optimally.
Mm-hmm.
With things like cancer, what happens is you produce these abnormal cells all the time.
And
Every day you produce.
everyone has the potential for cancer, don't they?
Everyone produces some abnormal cells, and then your immune system recognizes, oh, what's going on here? This don't look right, and it will kill it. What happens in the case of cancer is that your immune system doesn't recognize this cell as being completely abnormal, and then that cell is allowed to proliferate, meaning that cell is allowed to make more cells and more cells, and that grows into a tumor. A tumor just means any excess growth of any kind, which can be a tumor that's just benign, meaning it's not causing cancer, or tumor that is malignant, meaning that it will cause cancer and it can spread and it can affect many places in your body. Now, there's been a lot of talk about things like nature versus nurture, meaning that you have a genetic predisposition to some things, so that my ability to protect myself, my ability to pick up certain diseases is partly based on the genes that I've collected from all of my ancestors on both sides of my family, and partly based on the environment that I'm in, and partly based on the lifestyle that I live. So nature and nurture contribute.
Right.
There's ongoing research into how those things happen. In the case of cancer, in the case of diabetes, or chronic diseases like that, and in the case of more acute things like respiratory infections like coronavirus, things like HIV, etc., etc. Well, HIV we know for sure it was an infection of why some people become more unwell and others don't have quite as severe or quite as intense a reaction. Or some people are just immune, because we know that there are some people who are immune to HIV. You know, there's some people who are exposed to coronavirus and just don't catch it. Mm-hmm. Now, those people have not done anything particularly special. There's a nature component, so an underlying innate genetic component to their makeup that makes them like that. Mm. That being said, you can have an immune system that is working suboptimally, meaning it's not working as well as it should be working. And so things like eating healthy, so eating your celery and your ginger and your garlic and your who and your what and your vegetables and everything, that will contribute. Exercising, you know, moderating the amount of alcohol that you consume, taking your vitamins and your micronutrients, all of these things contribute to maintaining good health, good healthy immune system, a good healthy immune response, making sure that your bone marrow has everything that it needs, that your lymphatic system has everything that it needs to produce the cells that you need to produce your white cells, to produce your red cells, to make sure that your heart carries the oxygen that your cells need, to all of those things to work together to make sure that you are the healthiest that you can be. All of those things to work together to make sure that your body is not recognizing its own self as foreign and fighting against itself. Mm-hmm. But in terms of, can I go beyond what is my optimal level of immune system? Not really. Okay. That there isn't.
No, if you've got if you're predisposed to certain illnesses or certain illnesses, that means that you've always had a pretty low immune system. There's no way for me to change that with a certain diet or certain.
Well, so if you've got something like, let's say you have asthma, for example, because asthma is very common. And because you have asthma, you are always going to be more likely to pick up respiratory illnesses. That's a given. You're more likely than anybody without asthma to pick up respiratory illnesses. You cannot change that because you have asthma. But what you can change is how well your asthma is controlled, how well, and certain nutrients like vitamin D can control, if you're kept at a normal level, if you're not deficient of these nutrients, they can make sure that your body's own immune response, your autoimmune response, is not going to react in such a way that is going to be to your detriment. So your body's not going to have this hyperimmune response that is going to then make your asthma worse, and then make you then, if you catch a cold, make you very, very unwell. You may have a severe asthma attack. So yes, eating a certain way and living a certain lifestyle can make you healthier and will make you healthier, but it will only do that to a certain limit.
Yeah.
Like, you can be the best that you can be, but you can't just all of a sudden with certain foods cure your asthma. Or that's not going to happen. That's not the way our bodies work, unfortunately.
What about people who have changed their diets and then all of a sudden their ailments or their illnesses have gone? Like, what about in those circumstances, which I know are not, quite rare or whatever?
So those things are because those things are multifactorial. So for example, you have the person, let's say you have the person who is obese, sedentary, and eating very unhealthily. And they've got asthma, sleep apnea, and diabetes, and they had a heart attack. And because they had a heart attack, the doctor says, you now need to exercise and change your diet because your cholesterol is too high, the arteries to your heart are almost all the way clogged. We need to sort you out. Right. Okay. And that person now loses half of their body weight, and they're now within a healthy weight. And they recognize that they're not struggling anymore to sleep at night because the weight is now gone. So the sleep apnea has now disappeared. Because they're now becoming more active, then their level of resistance has increased. So their asthma they're not having asthma attacks every week because they're not putting this extra strain and this extra demand on their lungs for immediate need for oxygen because they're walking just slightly faster than before and giving their bodies this immense amount of stress because of the most minimal exercise. The bodies have now worked through and they're able to tolerate a lot more exercise than they were before. So it seems like their asthma is cured, but their asthma is just now really under control because they've changed their life. They're now no longer having high blood pressure because, again, they've changed their life. Their vascular resistance is reduced, the cholesterol is lower, etc., etc., etc. So yes, you can cure diseases, you can cure illnesses, or you can get illnesses to a point where you are completely asymptomatic if you change your life. But you haven't changed your genetic predisposition, you haven't changed your genetic makeup, you've just changed all of the nurture components of the thing that was making you unwell.
So it's kind of like when people say vegans are more healthy. Vegans, suffer less, don't suffer from heart disease as much, etc., etc. But then when you look at, normally when someone turns vegan, it's the whole lifestyle. They'll stop smoking. Normally when someone turns vegan, they'll stop smoking, they'll start doing more exercise, they'll change their diet. So there's more things that they're doing that contributes to them having less illness.
Funny enough, there is a problem within the developed world of people who become vegan and are now deficient in many micronutrients, like vitamin D,
B12 as well.
and vitamin B, and iron deficient in a severe way, you know, so, and they can be quite protein deficient, especially the young children, and infants and toddlers. So that in itself comes with its own little package of problems if it's not done. This is not me saying not to eat vegetables. This is not me saying not to be vegan. It is me saying that if you are going to do that, especially with a pediatric age child, please consult a dietitian. Please, please, please.
Yeah, you have to do research.
But yeah, exactly. You change your lifestyle and then you're like, oh, I'm much healthier. Well, yeah, but my grandfather ate meat all the time and he was fine. You know, like, so.
The same. My nan lived to 95. She ate meat, she ate chicken, she ate fish. So yeah, I guess it's not one rule fits all, isn't it? It's like some people it works great, and there's some people actually that I know can't eat vegetables because it causes inflammation. Like they can't eat vegetables, they have to eat meat, they have to eat fish or they die, because they literally live there. That's their staple foods because it causes inflammation of their intestines. So, you know, it's not one rule fits all. So it might work amazing for some, but not for others. And I think we just have to acknowledge that. But I think that brings us quite nicely to a close, to an end. And I really enjoyed that discussion. And I hope a lot of people get some useful information from that. We really appreciate you joining us, Claudine. I was going to say Dr. Ogilvie again then, but I really appreciate you joining us. That was so good. Loads of information, and it would be good to have a follow-up maybe in a year's time or whatever and just catch up on more information.
Before I forget, for any teenagers who are interested in medicine, there's a British Caribbean Doctors and Dentists Network, and if you search on Instagram, they're on Instagram, and if you're looking for a mentor, you'll be able to find one in there. I mean, I only found other Caribbean doctors this year after being here for 6 years, but if you're looking, you know, there are people around, there are some of us around. There's the Black Women in Health group that is African and Afro-Caribbean and Black British doctors and nurses and social workers and pharmacists and et cetera, you know, so just please don't feel like you're by yourself. Sorry, I had to get that in there.
No, that's amazing. And I did want to, I would have been, you know, knocking my head after thinking, oh, forgot to say that. So thank you for, you know, paying attention and reminding us. I didn't know that. So what I'll do, I'll just put the information below this video and people can find them for themselves. Brilliant. Thank you ever so much. Speak to you soon.
No problem. Okay.